Welcome back to Daybreak. Well, March is Colorectal Cancer Awareness Month. One of the symptoms of the disease is constipation. Not something we often discuss, or a lot of people don't want to talk about it, but it is very important. And joining us in the studio this morning is Baptist Health's Dr. Janelle Dawkins with Sherwood Family Medical Center. Thank you so much for joining us.
Always my pleasure.
We were just talking about people don't want to talk about this.
Right.
But it's so important.
Super important, and it's something that we have to talk about, right? I just noticed a lot of patients were coming into clinic and talking to me about constipation, and from our conversation, it became evident that a lot of people did not know that you do not have to have a daily bowel movement.
Okay, so what does the timing need to be like?
So that's an individual question, right? So each person is going to be different. So I always encourage patients, you know your body best, right? You want to get to know your normal. When things get abnormal, you want to let your doctor know. So when you're starting to experience bloating, like we don't want you to not have a bowel movement and then start getting bloated and uncomfortable. But you don't have to have a bowel movement every day.
People just don't want to talk about this, though. So,
Yes.
What would you say to encourage them to open up to their doctors?
Right. So this is very important. You want to get to know your body, get to know your normal, get to know what your stool looks like so that you can know if there's something that you need to talk to your doctor about.
Okay, so what kind of advice do you have going back to constipation? What's something that you can do to help relieve that?
Right. So a big thing I tell my patients is get 7 bags, Ziploc snack size bags, fill them with high fiber foods. Eat one every day. Drink as much water as you can, as you can tolerate each day. And then make sure you're exercising daily. Make sure that you have a bowel routine, and consider getting a footstool, which is just a little step stool that you put your legs up on.
Like the squatty potty,
like
right?
a little squatty potty, that's it.
Okay, and we have the symptoms up on our screen. But once you start seeing these symptoms, when do you need to actually call your doctor and get an appointment?
Right. So, the timeline is once you get to know your normal, you'll know when something's abnormal. One thing that's not on the symptoms is basically if your stool starts to get very thin, like pencil shape and size, you want to let your primary care physician know.
Yeah, so you need to look in the toilet to see.
You have to look to see.
Okay. The screening starts at what age?
45 is the new age.
Okay, but if you do see symptoms before 45, you do need to talk to your doctor?
Right, you need to talk to your doctor. So what I want to just distinguish something, right? When you're screening, you don't have symptoms. So at the age of 45, we start. We don't want you to have symptoms. But if you're having symptoms, no matter what age you are, please talk to your family care or your primary care physician about it.
All right, thank you so much for all the wonderful advice.
Always my pleasure.
Yes, thank you for joining us. Well, if you want to get in touch with Baptist Health, just go to our website or call the number on your screen.